So I've been thinking that trust is earned. Oh, okay.
Okay. Yeah.
So we know that if a patient trusts the medical system or the mental health system, you're going to get better results. That's an earned process. You cannot just provide a form and have someone complete it, and then you have all your answers with you. So I'm thinking about the micro and the macro levels. In the micro level, I'm a visual person and a storyteller, so hopefully I'm not going to bore you. But I'm married to a physician who is boarded in palliative care and healthcare, nice Jewish boy from the Midwest, who's been very privileged until he developed Parkinson's disease. And we just traveled together. The way they treated him and the airlines and the passengers is the way I've been treated as an immigrant. And also as a black child, the same way. So people question that I was his wife. People question that I'm the mother of a black child. So what I learned with this is that we have a lot of humor in our family. And my husband said, oh boy, I would have been a much better doctor if I knew what it's like to have Parkinson's. First of all, I'll be very, very careful about sending patients for MRIs because I'm scared to death about going to an MRI machine. And second, I would have been a much better provider. And what I think that we as providers have to start thinking about it is really find in ourselves what are the ghosts that we have, what are the fears that we have. And I think that sometimes when we ignore the presence of a black person or a Parkinson's person, it's because we're afraid of how all these people have been treated. And we're afraid that will happen to us. And so it's kind of thinking about what are our ghosts, what are the triggers that makes us ignore what's the elephant in the room. Is that right? There is a barrier. Maybe there is not a barrier. And what has helped me personally is not focus on the barrier, but focus on the human being next to you and what I have in common with a human being. So most likely with you would not be my accent. Is that right? But I'm a provider like you are. I'm a woman. I'm a mother. So these are the things that connected me with the patient. And as I connect with the patient, then I earn the right. And that patient, it's an equal balance relationship. And I think that we as providers need to start looking at ourselves and how we interact with others and what are the things that we need to improve about ourselves. And then all these wonderful things that we all learned today and that we practice are all parts of another dimension, which is the microsystems. Is that right? We know that there is in the microsystem a big divide in the healthcare. So we have social workers, we have psychiatrists, we have surgeons, we have nurse practitioners. The income and the eligibility in terms of benefits are very different among the healthcare providers. And so we have a tendency, when we have a problem patient, a patient that demands a lot of you, that the people who are in the lower ranks are the ones who are going to be taking care of this patient. Is that right? So somehow we're putting value on what's easy for us to treat and value on what we think it's not so easy to treat. So just think about how we interact ourselves and how we interact with a larger system. And there is a divide. And I'm not sure if it's right or wrong, but there is a divide. And so we don't have, I don't have a nurse. This is not my nurse. This is a nurse that is my colleague and works with me. The same thing about illness. I'm not a Parkinson's patient. I'm a patient with Parkinson's disease. And we as clinicians think about, and my husband did this, my nurse practitioner, as if he owned a nurse practitioner. So we need to start thinking about how we treat our colleagues and what value do they bring and how we value them.